What's up, everybody? This is Dr. Nick with Leverage Media, and welcome to another episode of Path to a Million podcast. This is Friday. I think it's April 10th. A lot of people woke up with a surprise stimulus money in their banking account or their checking account this morning. It is part of the C.A.R.E.S Act. It's called the Provider Relief Fund. And it's basically there was $30 billion that was included in the C.A.R.E.S Act. That when I first read about it, I kind of thought that it just meant basically like that hospitals and like people that were dealing with COVID, like actually needing like PPE, like those. I just didn't assume that it would affect all providers that bill Medicare. But it looks like it did. So I got a couple messages this morning about like, what's this HHS money? I got to check for this amount in my checking account. So I just checked my account because I've been waiting for my PPP money. So I was just double checking to make sure they hadn't just deposited it without me knowing about it. And I saw $2,016 and some odd cents deposit in my checking account. And so I started looking into it, and I just wanted to go through this stuff with you guys. So there's two different things that you need to know about. First is like the kind of the point of the Provider Relief Fund, and then the terms and conditions, because you have to accept the terms and conditions to accept the money. So in terms of the program itself, $30 billion is being distributed immediately with payments arriving via direct deposit beginning April 10th, 2020 to eligible providers throughout the American healthcare system. These are payments, not loans, to healthcare providers and will not need to be repaid. So who is eligible for the initial $30 billion? All facilities and providers that received Medicare for fee-service reimbursements in 2019 are eligible for this initial rapid distribution. Payments to practices that are part of a larger medical group, well, it's probably not you guys, but part of larger medical groups will be sent to the group's central billing office. As a condition to receiving these funds, providers must agree not to seek collection of out-of-pocket payments from a COVID-19 patient that are greater than what the patient would have otherwise been required to pay if the care had been provided by an in-network provider. And the quick dispersal of funds will provide relief to both providers in areas heavily impacted by the COVID-19 pandemic and those providers who are struggling to keep their doors open due to healthy patients delaying care and canceled elective services. Let's see, how are payment distributions determined? They will be distributed, providers will be distributed a portion of the initial $30 billion based on their share of total Medicare fee-for-service reimbursements in 2019. Total fee-for-service payments were approximately $484 billion in 2019. So the way that you do it is you figure out how much you billed Medicare. Now this says take how much you billed Medicare versus how much you collected from Medicare. So the disbursements are what they're saying that it's based off of, but here in this example, they're saying billed. So not exactly sure which number. Let's see, a provider can estimate their payment by dividing their 2019 Medicare fee-for-service payments. So I would just do payments because it looks, they said payments in one and billed in another. But so you take your payments from Medicare, you divide it by 484 billion, and then you multiply that by 30 billion, and that'll give you your amount that you'll get into your checking account. What to do if you were an eligible provider? So HHS has partnered with HHS is Human Health and Human Services. It's just a department, like a federal government department. They've partnered with United Health Group, so UHC, to provide rapid payment to providers eligible for the distribution of the initial $30 billion funds. Providers will be paid via automatic clearinghouse account information on file with UHG or the Centers for Medicare and Medicaid Services, CMS. So if you're billing Medicare and you're getting payments, even if you're not even if you don't accept UHC, they should have your bank account information through Medicare. The automatic payments will come to providers via Optum Bank, which is who UHC uses, with HHS payment as the payment description. Providers who normally receive a paper check for reimbursement for CMS will receive a paper check in the mail for this payment as well within the next few weeks. Within 30 days of receiving the payment, providers must sign an attestation confirming receipt of the funds and agreeing to the terms and conditions of payment. And we're going to go through the terms and conditions here in a minute. The portal for signing the attestation will be open the week of April 13th and will be linked on this page. So I've provided this page in the Dr. Nick Silveri group if you want to do that. But it's basically hhs.gov/provider-relief, and you'll get it there. So HHS's payment of this initial tranche of funds is conditioned on the healthcare provider's acceptance of the terms and conditions, which acceptance must occur within 30 days of receipt of payment. So I received mine today, so I basically have until probably May 9th or 10th to be able to, I would assume, to be able to keep the money. If a provider receives payment and does not wish to comply with these terms and conditions, the provider must do the following: contact HHS within 30 days of receipt of payment, and then remit the full payment to HHS as instructed. Appropriate contact information will be provided soon. Is this different than the CMS Accelerated and Advanced Payment Program? So there was another program to get you Medicare money faster. And yes, this is a different program. The CMS Accelerated and Advanced Payments are a loan that providers must pay back versus this, which is basically just like a grant, I would say. How this applies to different types of providers. All relief payments are being made to providers and according to their tax ID number. For example, that doesn't really... Basically, it's basically saying that they're using your tax ID number that they have on file with Medicare to decide. Okay, and then let's see, priorities for the remaining $70 billion. So there must have been $100 billion that was earmarked in the bill. The administration is working rapidly on targeted distributions that will focus on providers in areas particularly impacted by the COVID-19 outbreak. Rural providers of services with lower shares in Medicare reimbursement or who predominantly serve the Medicaid population, and providers requesting reimbursement for the treatment of uninsured Americans. I would guess that they're going to use that money, because when I originally read about this program, it seemed like that's who they were going to send it to, is people that were on the front lines, the hospitals, the rural places that the hospitals don't make much money. So it looks like the other $70 billion is going to be used for things like that. Ensuring Americans are not surprised by bills for, let's see. Basically, it's just saying I think this is more for hospitals, if you're billing someone for COVID-related treatment, that you're not going to charge them maybe more than their copay. So I don't think that really applies much to us. So let's look at the terms and conditions. Just give me 1 second. I need to push a meeting back. Just 1 more second. All right. Let's see. Relief fund payment terms and conditions. The payments are meaning the payment that we're talking about from the provider relief fund. Let's see. The recipient certifies that it billed Medicare in 2019, currently provides diagnoses, testing, or care for individuals with possible or acute cases of COVID-19, is not currently terminated from participating in Medicare, is not currently excluded from participation in Medicare, Medicaid, and other federal healthcare programs. It does not currently have Medicare billing privileges revoked. So someone asked about do non-participating providers qualify, and it looks like this probably means that it doesn't, because it says is not currently excluded from participation in Medicare, which I would imagine that means non-participating providers. The recipient certifies that the payment will only be used to prevent, prepare for, and respond to coronavirus, and shall reimburse the recipient only for healthcare related expenses or lost revenues that are attributable to coronavirus. The recipient certifies that it will not use the payment to reimburse expenses or losses that have been reimbursed from other sources or that other sources are obligated to reimburse. So this is going to be a little bit of there's going to be some fine print in here that you need to make sure you follow. This seems to be one of them. So the recipient certifies that it will not use the payment to reimburse expenses or losses that have been reimbursed from other sources or that other sources are obligated to reimburse. For example, the PPP program. If you're so the way the federal government, we've talked a lot about the EIDL advance, the $10,000. Well, now it's like $1,000 per employee. So we've talked about that and the PPP together. They do not want free money being used for the same things. So this is free money. The EIDL advances free money. The PPP can be free money. So they don't want the EIDL money being used for things that the PPP program would be used. They don't want this provider relief fund money being used for stuff that's earmarked for the PPP. So just don't use it for the things that are allowed in the PPP program. So don't use it for payroll. Don't use it for utilities. Don't use it for rent. Don't use it for interest on your mortgage or your business loans. So there's lots of other things you could spend it on. Use it for that. The recipient shall submit reports as a secretary determines are needed to ensure compliance with conditions that are imposed on this payment, and such reports shall be in such form with such content as specified by the secretary in future program instructions directed to all recipients. So again, just be sure that you are, maybe I maybe even write checks to use this money to help pay bills. And just in the memo line, maybe say provider relief fund so that you can easily go back and look. Not later than 10 days after the end of each calendar quarter, any recipient that is an entity receiving more than $150,000 total in funds under the coronavirus aid, this is the C.A.R.E.S Act, the coronavirus preparedness, the Family First, or any other act primarily making appropriations for the coronavirus response and related activities, shall submit to the Secretary and the Pandemic Response Accountability Committee a report. This report shall contain the total amount of funds received from HHS under one of the foregoing enumerated acts, the amount of funds received that were expended or obligated for each project or activity, a detailed list of all projects or activities for which large covered funds were expended or obligated, including the name and description of the project or activity, and the estimated number of jobs created or retained by the project or activity, where applicable, and detailed information on any level of subcontracts or subgrants awarded by the covered recipient. All right, so if you're receiving more than $150,000 total in funds under basically all of the coronavirus stimulus bills, it looks like no later than 10 days after the end of each calendar quarter, any recipient that is an entity receiving more than $150,000 total in funds under the C.A.R.E.S Act, the Corona Preparedness and Response Supplemental Appropriations Act, and Family First Coronavirus Response Act, or any other act primarily making appropriations for the coronavirus response and related activities, shall submit to the Secretary and the Pandemic Response Accountability Committee a report. So it sounds like if you're getting over $150,000 in total across any of these programs, including the PPP program, including the sick leave and the FMLA. So if you're a larger practice, you definitely need to keep an eye on this and be sure that you are complying with all the necessary components of it. The recipient shall maintain appropriate records and cost documentation, including, as applicable, documentation required by some type of code, record retention and access. So again, just keep access. I really doubt that they're going to ask for documentation for these couple $1,000 loans, but I would keep it just in case. I would just make a mark in the memo of what it is that you're using the money for. Let's see. Is there some? just another thing that says basically, accordingly, for all care for a possible or actual case of COVID-19, recipient certifies that it will not seek to collect from the patient out-of-pocket expenses in an amount greater than what the patient would have otherwise been required to pay if the care had been provided by an in-network recipient. So if you're out of network, that part I don't really quite understand. Here's another thing that is going to be, you need to pay attention to. The following statutory provisions also apply. General provisions in FY 2020 consolidated appropriation, executive pay. None of the funds appropriated in this title shall be used to pay the salary of an individual through a grant or other extramural mechanism at a rate in excess of executive level 2. So I don't know what executive level 2 is, but it says that it should. I originally had read that it, like, I just stopped reading it. The shall be used, or none of these funds shall be used to pay the salary of an individual. But it looks like salary of an individual at a rate in excess of executive level 2. So you might need to find out what executive level 2 rate is. Let's see. None of this money can be used to advocate or promote gun control. So, okay. Looks like none of this can be used for lobbying. Not going to really matter to us. It doesn't look like you can use this money for abortions, so be careful there. Limitations on abortion funding prohibition, I don't think that really applies. Prohibits use of funds for embryo research, prohibits promotion of legalization of controlled substance, pornography, prohibits funding Acorn or its affiliates or subsidiaries, prohibits federal funding for needle exchange except in limited circumstances. Propaganda, non-disclosure agreements. So there's a lot of like unpaid federal tax liability. None of the funds made available by this or any other act may be used to enter into a contract, memorandum of understanding, or cooperative agreement with, make a grant to, or provide a loan or loan guarantee to any corporation that has any unpaid federal tax liability that has been assessed. You guys can read all the definitions there. And a lot of this other stuff is trafficking in persons. Yeah, so that's pretty much it. If you get it, it sounds like if you sign this piece of paper that they're going to make available on the 13th, that you should be good. Just be sure that you're keeping track of it. You're not using it for things that are covered in the PPP program. And let me get to these questions. All right, let's see. Michelle, do we need to fill something out to get this? We are participating with Medicare. Checked account this morning and no deposit. So it's going to be rolling out over the next couple of weeks, it sounds like. You don't have to fill anything out. Everybody that got it this morning, I think, was pretty surprised. So whatever I talked about the way to calculate it, but whatever you collected in 2019, divide that by, I think it was like 484 billion, and then multiply that by 30 billion. Paper checks from Optum will come next week, so that's good. Our Medicare auto deposits into our account, so it should go straight into, if you don't use United, it looks like if you're not part of Optum to where you get checks from Optum, it looks like whatever bank account you're using, whatever you get deposited from Medicare, like they have your bank account information, so they'll probably just auto deposit it in from there. Got it. Yes, we get paper. So next week it is. Thank you for blaming me. All right. So I think we got everything. Let's see, here's another one. I'm not a Medicare provider, so I won't be getting any. This may be the only time. Oh, okay. That's nothing. All right. So hopefully that helps. Not a whole lot that you need to do. Don't have to apply for anything. It's just, you either billed and got Medicare payments in 2019 or you didn't. And if you didn't, you're not going to get any money. If you did, you'll get some money, and then you'll have to sign this paper, and you got to sign it within 30 days. So just be on the lookout for that. Clint, what money? There's in the C.A.R.E.S Act, there was $30 billion for what's called the Provider Relief Fund. If you go back and watch this, it goes through all the details of it. But basically, it was $30 billion if you billed if you got distributions from Medicare in 2019, you will get some portion of the $30 billion. Like for me, we don't do a lot of Medicare, but we do some. We got $2,000